Okay, so now I'm going to perform the abdominal and the renal assessment. I'm going to inspect her abdomen, checking for any pigmentation, any scars, any stretch marks, checking her respiratory movement, checking the contour of her abdomen, making sure it's symmetrical, checking her rectus abdominis muscle. Also, I'm checking for any masses or nodules and any visible peristalsis or palpitation or pulsations. Alrighty, so now I'm going to auscultate her abdomen. I'm going to start on her right lower quad with the diaphragm. And I'm going to lightly touch her stomach. Okay, so I'm going to change to the bell in my stethoscope, and I'm going to check her arteries. First one is going to be her aortic artery, her renal artery, her iliac artery, and her femoral artery. And then I would do that on the other side as well. Okay, and now I'm going to percuss her abdomen, and I'm normally checking for any, I'm going to percuss her abdomen, and normally you'll hear a timpani sound, and you wouldn't hear that over any organs or masses. Good. And then I percussed her kidneys on the respiratory assessment. So now I'm going to do a light palpation about 1 to 2 centimeters deep. If she had complaints of any abdominal pain, I would make sure I would do that side last. Okay, so now I'm going to do a deep palpation. That's going to be about 1 to 2 inches deep. Good. Okay, so now I'm going to check for her liver. I'm going to place my left hand underneath her left rib cage and have her push up. And then I'm going to push down and have her take a deep breath. Okay, and I'm checking the liver to make sure it feels smooth and rubbery. Okay, so now I'm going to check her spleen. I'm going to reach across from her. And make sure my hands are pointed towards her axillary area. And I'm going to push together. If I can feel the spleen, I will immediately release and notify her primary care doctor. So now I'm going to check, I'm going to palpate her kidneys. I'm going to place my left hand underneath her left flank, and then my right hand, the right costal margin, my left hand, the left costal margin, and I'm going to push. Take a deep breath, and I'll push my hands together. Good. Okay. So now I'm going to palpate the aorta, which is about 2 inches above the umbilicus. And then I'll palpate her femoral pulses. Okay, and then I'm going to check her inguinal nodes. I'm going to get you to bend your leg up just slightly. Okay, so now bend this one up just slightly. Good. Okay. So now there's 3 advanced techniques that we can use to check for any abdominal pain, like cholecystitis or appendicitis. So the first one I'm going to do is the Murphy sign. What you do is press on the patient's right-sided abdomen. If she experiences, I'm going to ask her to take a deep breath. If she couldn't fully take in a deep breath, then that's normally indicative of cholecystitis. Okay, so my next one is I'm gonna check for referred pain. I'm gonna press on her abdomen. You can press on it anywhere, and I'm gonna ask her if she's experiencing any pain. Any pain anywhere in your abdomen? Good. Alrighty, so now I'm gonna check for the ileopsis. So what I'm gonna do is I'm gonna have a patient. I'm gonna push on the patient's. I'm gonna have the patient raise her left leg, and then I'm gonna push on her muscle. And normally that tightens your abdominal muscles, and then if she had any pain, that would be indicative of inflammation. Okay, let's do the other one. Any pain? Okay, good. Alrighty, and now that I would chart that her bowels are active. I would chart her last bowel movement. I would chart if anything was any abdominal protruding, any abdominal pain, and then I would rate her pain and ask her to describe it for me. And then I would check if she was positive Murphy sign, then I would do positive Murphy sign, but in her case it was negative Murphy sign. And then I would ask her about her urinary system, if she has any, I would chart if she had any flank pain, if she heard the color of her urine, if she had any odor to the urine, if she's unable to urinate, I would check and make sure I would chart that if she had a catheter, then I would chart a catheter and then what size it would be, and the color of her urine with the catheter, and then I would make sure she's voiding the correct amount and taking in the correct amount. And then also if she's having any trouble urinating, or if she's urinating a lot but not urinating enough. And then I would chart that, like I said, our bowel sounds were active, and that I didn't notice any scars or any wounds or any drainage from her umbilicus area. And that's about it. That concludes the end of my assessment.